Best Cost is a Horizon Europe research project funded by the European Commission looking at the health costs of air and noise pollution. In our podcast, we talk with the researchers involved to learn more about how their work can build the evidence for stronger policy action on pollution. This episode, we are talking to Alberto Castro Fernandez and Axel Luyten from the Swiss Tropical and Public Health Institute, who developed the healthiar package as a tool to calculate the health and socioeconomic impacts of pollution. So welcome, Alberto and Axel. First, just would like to hear from you, what is it you do in general at Swiss TPH?
Hi, Eleanor. Hi, everyone. Yeah, my name is Alberto Castro and work at the Swiss TPH. And my main role there is to quantify health impacts attributable to air pollution, noise, and some other environmental factors. Yeah, and happy to be here to talk about healthiar.
Yeah, hi, everyone. Hi, Eleanor. I'm so happy to be here. My name is Axel Luyten. I also work at Swiss TPH. Mostly around how the environment impacts our health. So how air pollution, noise and heat, for example, influence our health. And exactly, that's it.
Welcome. And so, today we're going to be talking all about the healthiar tool that you've developed together. But so firstly, can you explain to us what exactly is the healthiar tool?
Well, before going to the healthiar tool in itself, we would like to say something that, probably many people already know. Air pollution is harmful for people. There is a strong evidence in the literature, in scientific evidence that there are health effects caused by air pollution. There are many of them. They can cause premature deaths. They can cause lung cancer and many diseases. And this is already clear. The difficult task here is really to quantify how many deaths can be attributed to the exposure to air pollution, for example, also for noise, other environmental factors. And the way to calculate it is already quite established, but can be sometimes a bit annoying. And the healthiar tool is facilitating this task for people that normally make this quantification of health impacts. So just to frame this in the topic.
And the typical application of these quantifications might be that in a city or in a country, policymakers are interested in what is the impact of air pollution on the population, or in a city, how many people get highly annoyed by the noise from traffic, for example.
So this is really good. And so a question about that is, it sounds very technical and using quantification. So how is it that healthiar can be relevant for policymakers in the work? Can they use it directly, or is it elsewhere that they can apply it?
That is a very good question. Actually, the healthiar package is an R package. It's based on a programming language, open source programming language, which is called R. And this is really aimed for programmers, not directly for policymakers. But the conclusions of the calculations that the estimations that we do with the healthiar package, of course, they are highly relevant for the policymakers. So the idea is that the technicians that work together with the policymakers, they may have some programming skills that they use, and then they use the R package, the healthiar package, to perform the calculations to quantify how many premature deaths or how many cases of diseases can be attributed to air pollution or noise, and even to monetize the health impacts, because it's an additional step in the work once you have the number of people that have prematurely died or people that have a new disease because of the exposure to this pollutant. Additionally, you can monetize, you can translate the health impact into money, and this is something highly relevant for policymakers because when they think about improving the quality of life of citizens, of course, they have always to balance cost and benefit, and having the monetary benefit of an intervention of, let's say, making a new cycleway or doing more wide, more broad interventions like, calming traffic or these kind of things, they can know how many health impacts can be prevented, and based on that, how much money was saved. And if you put together the investment that you do with the benefits that you got with your intervention, at the end you can say if it was costly or if it was worth actually doing that. And the R package healthiar can quantify the health impacts, but can also monetize the health impacts that you obtain.
Yeah, you mentioned different like interventions, like policy interventions. Is there other examples you can think of that we can do to improve air and noise pollution?
Yeah, for example, a typical intervention on a city scale is introducing low emission zones. So only cars or vehicles that don't pollute the air too much are allowed into the city, or also subventions for electric cars, as electric cars, they pollute the air less than other motorized vehicles. Or, for example, an intervention to reduce noise would be that airplanes, for example, are not allowed to land or take off during the night. That would be an intervention also. And of course, there are many others on small scale or really larger scale at city level or even at the country level.
Yeah, and then you talked about the whole idea of monetization as a tool, looking at the value of it. So this could be useful then in terms of, yes, like investing in electric cars, or as you mentioned, not having planes taking off at night. That could, of course, get some pushback, for example, maybe if people want to make more money with that. But then you're saying there's actually a much longer term cost benefit that the R package can use to calculate this.
Yeah, exactly. So this kind of gives you a counter argument to these claims that this policy will cost way too much. It's not worth to invest it. But if you then look at the health impacts, the lives you can save or the lung cancer cases you can prevent, these also come with health and monetary benefits. So the R package then really gives you this counter argument to argue for cleaner air policies or other policies that reduce noise. So we hope that this can really support evidence-based policymakers and support decision making in this way. And
then also talking about cost value, as you mentioned before, that it's the R package healthiar is open source. So if I'm correct, that means that it's free to use for anybody who wants to use it.
Yeah, exactly. It is open source. It means that it is publicly available for everyone and can be downloaded and installed by any R user. Yeah, I also wanted to remark that these kind of calculations, these quantifications that we normally do for health impacts, for monetization and so on, I mean, they are methodologically established. There are many researchers doing these quantifications. The point is that, they all make their own programming script. They write the code by themselves. The programming exercise can be quite annoying, can be very long, and it has many implications. One of them is that you have to check everything very well, that you don't have any mistake in your code. And of course, you invest a lot of time in programming this every time that you have to make this quantification. This is the main advantage from a point of view, or one of the advantages of the R package. It is the first R package that is out there to facilitate this task, so that people don't have to code to program the whole thing from the scratch. They already have something that helps them. And for those that are not that familiar with R programming, with R package and so on, I think I have to define first what is an R package. An R package is nothing else as a group of functions for programming. But I would like to make a metaphor here to make people understand better what it is. It is some kind of mobile app for programmers, let's say. There are people making apps for your mobile phone. They develop this app, and when you get this app from your store, you install it and you think, oh, great, it makes my life a bit easier because now I can do this task in a better or a more efficient way. It's great, and you use it in your mobile phone. The R packages in R works in a similar way for programmers. They can do the same task, but they invest much more time. They might feel more insecure if they are having mistakes or not. And because of this R package, they install it in their computer in the same way you install, or in a similar way you install a mobile phone app. And then because you have this R package, this app, then you can program in a more efficient way. And this is, for those that are not familiar with an R package, this is what an R package is doing. The R package is open source. It means that it is available for everyone. The R programming language is also open source. And open source means that you can also see at the code that is behind the R package. And it has a lot of implications in terms of transparency and replicability. And we can talk more about that later if you want.
We definitely can. I think we're getting more into technical aspects of the R package, so we can really explain what does this mean. And you were talking about the quantifications around using healthiar, and what is the kind of information that you're using in healthiar to quantify in terms of things like exposures? Maybe you want to explain that to our audiences.
So the main three things or informations that we need are, for example, how high is air pollution or noise pollution? This is what we call the exposure. So the level of pollution that anybody at a certain time and at a certain place is exposed to. That's the first one. The second one is we have to have some information about health. So for example, if we want to quantify the attributable cases of lung cancer, we first have to know in the population we are looking at, how many cases of lung cancer are there in total. So that's the second one. This is what we call the baseline health data. And then, of course, there's one thing missing. So how do we link the exposure to health? And for this, we use what is called an exposure response function. So this basically tells you if you are exposed to level A or to a certain level of pollution, how many health impacts can you expect that are attributed to your exposure to the pollution. And with these three components, so the exposure, the baseline health data, and the exposure response function, we can then quantify which share of lung cancer cases, or also as an absolute number, how many lung cancer cases are attributed to air pollution in a city.
Yeah, maybe also relevant to say is that these three main input data are available out there in different information sources. The exposure is normally available in exposure models that are developed at national level or at European level. This data can be obtained. The baseline health data, so that the number of cases of your disease or the number of deaths are normally available at least in national level in statistical offices in the different countries. And the exposure response function that Axel mentioned before, it's normally available in epidemiological literature. So the scientific work that is published in scientific journals, in peer-reviewed journals, provide these numbers to enter them in the R package.
And yeah, I mean, as you were also saying, Axel, about understanding like how many cases of, for example, lung cancer can be attributed to air pollution. This is like also, again, hugely important for policymakers to know, I'm assuming, because for those of us here, and maybe a lot of our listeners know that different environmental factors can overlap with one another. So to being able to understand exactly what are the number of cases attributed to air pollution, for example, can guide policymakers in creating policies that are working on air pollution as well. Yeah, and then maybe we can go a bit more into the accessibility of healthier for research tools. Like Alberto, you've already talked a bit of how it's essentially like an app for those of us who are less familiar with the concept of R package, but also some interesting things maybe as well. You mentioned about the transparency, those researchers can get into the back end as well. And so does that mean that they can use the calculations, whatever you want to call it, for the R package, adapt it for their own needs, or is it that they can enter the data and things will change, work it out for them?
Yeah, definitely. Because when I said at the beginning that the R package is a group of functions in the programming, when you are programming, I meant that there are 20 functions in the R package. So each of these functions is doing something that is useful for performing these quantifications and monetizations. And all these functions each of them has a programming code behind, and this programming code is completely available for everyone. So you can look at the code that is behind each of these functions. So there is no black box behind the functions that you used for your programming exercise. So it is not only transparent, the tool itself, but for the users too. When they use the R package, healthiar, and when they publish this work and they say, we use the R package, then people can go to the code behind and they can read line by line what this R package was actually doing. So it is completely transparent what you did. It also enables that the work is reproducible, because it means that if you want to replicate the work of others, because these lines of code are available, you can really do the same. You can replicate exactly the same as others were doing, which is sometimes very important in science. And it opens really a lot of doors, let's say, in science, in open science, in really showing line by line what you did, so that the others can really do it. Of course, it is possible to publish these scripts without the R package, but this R package is making it easier and contributes to have a more open science, let's say.
And I think here it's important to add that it's not just that we uploaded the raw lines of code and that's it, but the R package comes with a bit of more of a starter kit, let's say. So there's a website where all the important information is linked. There's an introduction. There's a kind of a manual, and then what is called a R package vignette. Also, there's all the functions and the methods behind. They are described in detail, and the relevant scientific literature is also linked. And in addition, there's also a little intro video and let's say what is called a cheat sheet, so a little 2-page summary of the package that gets you started. So you're not alone alone in this. We really provided all the necessary information to get started with it. And of course, also, if there are questions, we are happy to help. So just reach out to us.
Amazing. I think you thought of everything when developing this tool. So it really is like an app that you can download and go get started right away. I wanted to ask, because Best Cost, of course, is looking at the socioeconomic costs of air and noise pollution specifically. But one of the points of healthiar is also to be able to be used with other environmental stresses. So how is it that healthiar can be used for different environmental exposures?
The R package healthiar was developed in the framework of the European project Best Cost, and Best Cost focused on air pollution and noise. And that's why the R package probably also goes into this direction too. But from the very beginning, we were very aware that we wanted to make an R package that is flexible enough for many users. We provide many functionalities in the R package to make it useful for many different purposes. And we also thought on the different environmental exposures that you might find. That's why, in theory, the R package can be used not only for air pollution and noise, but can also be used for other stressors. Actually, it was already used for other environmental stressors or exposures, such as chemicals, green spaces, physical activity that is not an environmental stressor, but it was also used for these purposes to quantify the health benefits of being active. I'm not sure, but I think it was even used for that. So, I mean, in principle, the methodological principles behind can be applied for many different purposes and many different exposures.
And maybe important to add here that the R package, it's not a stable thing. It's not something that won't change anymore. So in Best Cost, we developed now, let's say, the first version of the package. But in future, it might also be expanded as a part of other projects. And there might also be new features that might be added. So stay tuned also in the future for new features and changes.
Yeah, this is important to say because actually, there is always room for improvement in anything that you do in your life. And here we are aware of things that we could improve, expand in the future. And we take note of all these things that can be improved. And if we ever get additional funding to expand it or to improve it, we're always happy to do it. We actually have a channel for communication with users in a website, in the repository of the R package in GitHub. And there users can post suggestions for improvements or something like that. And we can communicate with them and inform them about the progress on that. The idea is really to make a tool that have a long life and that is longly supported and that people can really use it and can provide feedback if they need to improve something in the tool.
And then an example of a new feature that is coming soon, still as part of the Best Cost project, is that the healthiar, the tool will also be available for Python users until the end of the year. So we hope that this really opens up the use of the package for not only our users, but also people more familiar with Python.
So both, you've spent a lot of time, I'm assuming, on developing the healthiar R package. So I wanted to ask you, what is the motivation? What kept you going while working on this?
Well, I have to say that when I thought of this idea of creating the R package, at that time I was quantifying health impacts using a super huge Excel file, and the exercise was really annoying. I spent a really long time doing this exercise alone there, always scary of having any mistake there in my calculations, and it was super annoying making these kind of things in Excel. And at some point I created a code in R, but it was only for me. And I thought every time that I have a new project, I have to adapt it. And when the project is finished, this will be forgotten. No one else will benefit of this enormous amount of work. And that's why I came with the idea of creating the R package, because I wanted to create something that is useful for the others, that the others benefit of that. And I'm not the only one that is getting a more efficient R coding for quantifying health impacts. And this was actually the motivation behind.
For me, it was something similar. For me, what motivated me is that we weren't planning to just do this one analysis in this one setting with this, 2 or 3 scenarios. And then after that was done, as Alberto said, the code would just, be forgotten. But we would actually do something that can help and support people like us that were developing before their own code and really putting a lot of effort there. So yeah, making something that is useful to others and that can also be reused in the future.
And on the flip side, was there any particular challenges you thought like, "Ooh, this is tough," as you were working on it?
We documented every issue, every step that we had to do in the process, in GitHub, in the repository, and there were moments where we had a huge wave of tasks or issues that we had to address, and at that moment we really were a bit overwhelmed with the amount of work. At the same time, we were, I think, aware that we were creating something that is special, something that can be really useful for the others, and this enable us to move on. But maybe this was for me the main challenge, like having this enormous pile of things to do, and fortunately we were able to flat this wave and to come with the final product.
Yeah, we really surfed the wave there. I think that was a bit of a tough moment, but I think every project has those phases, and now at the end, now that healthiar is out there, it's even more gratifying when we receive nice feedback or people tell us that, "Oh, you've saved me so much time, thank you so much." So I think in the end it was really worth the effort, and I would do it again.
And then, I mean, as Best Cost is coming to an end as a project, and you're like healthiar is getting more and more out there, is there a particular favorite takeaway or moment from this that you have?
Yeah, I think as Axel was saying, this feedback from users, because as I said at the beginning, as I said before, the main purpose for me was really creating something that is useful for the others. And when you get the feedback from the users and they tell you that you are making their lives easier because of the R package, and they can now focus on other tasks that are relevant, that they don't have to spend so much time on programming in the things that the R package is doing, you feel like, okay, you did the right thing, and we got this feedback when we did some workshops to train people on how to use the R package, also in conferences where we presented the R package, and it was really nice to have people that approach to you and say, "Oh, I was using the package, and really it worked really well, and I like it very much." And this is something that makes you happy in the same way the others are getting more happy.
Yeah, you mentioned the workshops, and I think for me that definitely was one of the highlights. It was the moment when we were presenting healthiar to the world. I think we both were quite nervous for that moment, but it was just really nice to see that people were engaged and were already thinking about how they could use it, the R package in their projects or in their daily work. So that was very nice, this interaction, and maybe the package will also help to create a bit more of a community in this health impact quantification world, and that would be a really, really nice consequence of it all.
Amazing. That's what we love to see, all these successes going out into the world. Thank you both so much. It's been a real pleasure to talk to you about this. I feel like I'm more enlightened as well. And yes, I'm sure, as mentioned, people can also reach out to you as well to learn more about healthiar and how to use it.
Thank you for listening to this episode on the healthiar R package from the Best Cost podcast. To learn more about the project, visit best-cost.eu or find us on LinkedIn.